But we'll move on to the third speaker, who is Professor Rongqin. She's the director of the Department of Ultrasound, the third affiliated hospital of Sun Yat-sen University. She's a doctoral tutor and chairman of Abdominal Ultrasound Committee of China Medical Imaging Technology Association. She is the vice chairman of ultrasound branch of Guangdong Medical Association. She has experience in ultrasound imaging, liver transplantation ultrasound, assessments of hepatic fibrosis, elastography, early diagnosis of hepatobiliary tumors, etc. Professor Rongqin will talk about abdominal ultrasound. So please, the floor is yours.
Thank you, Chairman. Thank you for your introduction. Hello, everyone. It's my pleasure to give my presentation. My topic is abdominal application of intracavitary CEUS. Intracavitary contrast enhanced ultrasound, that is ICCEUS, is to inject diluted CUAs into physiological or non-physiological cavities, and is considered as a useful problem-solving tool. It has been recommended by EFSAM to identify needles or catheter position, to delineate any cavities or ducts, and to improve tracing of a fistula. There are many abdominal application aspects of ICCEUS. Today, I would like to introduce 4 main aspects, besides which introduced by Professor Law just before. The first one is evaluation of biliary tract. Real-time 2D ICCEUS and accumulation mode of 2D ICCEUS can be used to evaluate biliary tract. This is real-time mode. It is easy for us to observe intrahepatic biliary tract and the branches dynamically. And this is the accumulation mode of 2D ICCEUS. It is better for delineating the continuity of the bile ducts. Besides 2D ICCEUS, we can also perform the ICCEUS to display biliary tract stereoscopically. We can see the biliary tract structures more intuitive. For example, on this picture, we can see here the common hepatic duct, and here the left and right hepatic duct and their branches. And on this picture, we can see extrahepatic duct. This is the left hepatic duct and the branches. And this is the right anterior, and these are right posterior hepatic duct and the branches. So you can see these pictures. They look almost like beautiful biliary trees. ICCEUS can help us to evaluate biliary variation by delineating biliary tree to assess the location and extent of biliary obstruction, and to identify PTCD positions. These are intraoperative 3D ICCEUS in living liver donor transplantation. These images were similar to, or even better than, intraoperative X-ray cholangiography images. Intraoperative 3D ICCEUS can assess different types of biliary variations. For example, this is type C1 variation. That is the right anterior bile duct originates from the common hepatic duct. And this is the type D1 biliary vibration. That is the right posterior bile duct originates from the left hepatic bile duct. And these variations displayed by 3D ICCEUS were also confirmed by intraoperative X-ray cholangiography. And these research works had been published on UMB before. This patient suffered from Rongqin tumor, that is hilar cholangiography, hilar cholangiocarcinoma. The tumor located in the bile duct. 3D ICCEUS can display complete obstruction at common hepatic duct, which were also confirmed by X-ray cholangiography. This case was also hilar cholangiocarcinoma. The tumor invasion involved not only common hepatic duct, but also the conjunction and the left hepatic duct. After injection of diluted solenoid through drainage tube inserted in the right intrahepatic bile duct, the 3D ICCEUS displayed complete obstruction at conjunction of right and left hepatic duct. So the left intrahepatic and extrahepatic bile duct cannot be displayed at all. The second abdominal application aspect of ICCEUS is the guidance for percutaneous nephrostomy. ICCEUS is used to confirm the needle and the catheter position, to evaluate of obstruction size, and to assess the catheter-related complications. These films are quoted from Dr. Egli A. His article published on ultrasound medicine. We can see that the renal pelvic cavity was displayed by injection of diluted through percutaneous drainage. Here is the drainage tube by using 4D technique, that is real-time 3D. And these pictures were also quoted from Dr. Kaiti's article published on radiology. They explained that urinary tract obstruction size can be assessed by ICCEUS to see the contrast media appearance on different parts of the urinary tract after percutaneous nephrostomy. And the third abdominal application of ICCEUS is assessment of abdominal abscess. ICCEUS can use it to confirm the catheter position, to evaluate the communication between complex abscesses, cavities, or with other structures, and to assess the drainage effect during follow-up. These pictures are quoted from Dr. Egli A.'s article published on Scanned Journal Gastroenterology. There was a complex abscess in right liver knob. ICCEUS can display whether there were communications between cavities and can guide further placement of drainage tube. And these images was also quoted from Dr. Egli A.'s article published on ultrasound medicine. ICCEUS show the communication abscess cavity with clone sigmoidal in a patient with diverticulitis. And the last abdominal application fields of ICCEUS is the exploration of fistula. Now, there are only a few published research papers about the theme of ICCEUS for exploration of fistula. Most of them are case reports. So we had performed such studies from 2008 to 2016. 46 cases with fistulas were underwent ICCEUS in our including external and internal fistulas. We found that the diagnostic efficacy of ICCEUS for the detection of fistulas, especially internal fistulas, were higher than that of conventional ultrasound. For example, the diagnostic accuracy of gastrointestinal fistula by ICCEUS was 83.3%. And that work was also published in UMB. This patient underwent common bile duct carcinoma. PT-CD were performed for palliative drainage. However, the drainage effect was not good. After we injected diluted sonomy, we find that the portal vein was filled with sonomy at the same time when the intrahepatic bile duct displayed. So that means there is a biliary portal vein fistula. Let's see the dynamic imaging. Here is the portal vein, and here are the hepatic bile duct. And we can see here there is a very small fistula orifice here. We can see the contrast media flow from bile duct into the portal vein. And this fistula was also confirmed by X-ray. And this patient underwent radiofrequency ablation of cancer. After ablation, he suffered from urine leak. ICCEUS while catheter showed that the ultrasound contrast media just flowed from the bladder into the rectum. So here we can see here a very small fistula orifice. It is about 0.5 centimeter. This patient felt abdominal distension after Whipple operation. Ultrasound found peritoneal effusion and the drainage tube was inserted. When we injected diluted sonomy, we can find that not only the local effusion, but also were filled with sonomy. That means there is a gastrointestinal fistula here. After conservative treatment, the fistula was healed because when we injected diluted sonomy, we cannot see the demonstration of sonomy in the jejunum. So ICCEUS can help us not only to diagnose, but also to evaluate the treatment effect of fistulas. This female patient underwent uterus resection. Exudation was found in abdominal wall incision. So we used syringe hose inserted in the abdominal wall incision. After injection of diluted solenoid, we found that the contrast media flowed into the pelvic cavity. That means there was a celiac continuous fistula here. So we think ICCEUS is a very important imaging method for detection and classification of fistulas without radiation. It can guide treatment such as catheter drainage and also assessing treatment effect. However, there are several interference factors in detection of internal fistulas. Biliary gap, which makes the diagnosis of fistula with bronchus very difficult, and other interference factors like gastrointestinal gas. So some small or deep-located gastrointestinal fistulas may not be seen by ICCEUS. This patient underwent right liver knob resection for liver metastases. She coughed up sputum with bile. So the X-ray cholangiography confirmed there was a biliary bronchus fistula here, which could not be detected by ICCEUS. That means ICCEUS has limitations here. Summary. ICCEUS can be applied in several fields of abdominal, such as evaluation of biliary tract, guidance for percutaneous nephrostomy, assessment of abscess, exploration of fistula. It is safe, simple, and non-radiative, which can be used as an important supplement method to X-ray. That's all. Thank you very much for your attention.
Thank you very much, Professor Singh, for all these very impressive images. There are a few questions from the floor. The first question is from Dr. Alarcon, and it is, how many centiliter of SonoView do you use for biliary CEUS?
It depends on different situations. If the biliary tract had no, there is no obstruction on the biliary tract, then the dosage may be bigger. For example, 20 to 50 milliliter, or even larger. If there is obstruction for the patient, then the dosage is a little bit small. For example, 10 to 20 milliliter. Thank you.
Thank you. And another question is, when you suspect a rectovesical fistula, where do you inject the contrast? In the bladder or in the rectum?
In the bladder. I inserted already. Then we just need to injection the contrast media through the catheter in the bladder.
And the dose?
Thank you.
And the dose for the fistula? How many?
For that patient we had met, we injected a few minutes, maybe about 10 or more than 10 centimeter.
Okay, thank you. Another question just came. It's from Dr. Shaw. How does contrast medium measure hold?
You mean the
I think sorry. I think they mean if you measure on the contrast images, Is the measurement correct?
You mean the measurement for
For instance,
what?
the dilation of, I'm not sure I understand it correctly, but if you have a dilation of the biliary tract, if you measure on the ultrasound image of the contrast enhanced images, is the measure correct?
The measurement of the diameter of biliary, the diameter of the duct, I
Yes.
think maybe it's not so correct because there is somewhat blooming. Yeah.
Okay.
Thank you.
Thank you very much. We have no more questions. So with this, I would like to thank all the speakers for their excellent presentations. And also, I would like all of you to consider the CEUS Eurozone School in Shanghai. And I would also like to encourage you to apply for individual membership in EFSUM in order to benefit from all the offers from EFSUM. Thank you very much for your attention.
Thank you very much.